brings you to the office?
Yeah, so I've just been dealing with a bunch of back pain that started about 2 years ago.
Okay.
From I was just doing some barbell back squats one day, quite lightweight, and I just felt something.
Lightweight, what's lightweight for you? Because lightweight for you is not lightweight for me.
60 kilo warm up.
Okay.
And yeah, it was the first time I was squatting barefoot, and I felt something in my lower back kind of pop and dropped me to the floor, and I was in a bunch of pain.
Was it a pop or a crack?
No, it wasn't a crack. It's just, I felt like all of a sudden something just like clicked, or like, yeah, I think the best way to describe it would be like a popping feeling.
Okay, center or towards one side?
To my right side.
To your right side.
Sure.
Okay, that makes sense.
And
okay, and then you fell to the floor, or you went to the floor?
I had enough, I guess, energy to still rack the bar,
Okay.
like after completing one rep, and then I fell to the floor.
Got it. And how long were you down before you got up?
About 20 minutes.
20 minutes. Okay, that was 2 years ago.
Yeah.
What happened then? What treatment did you see? Did you see anybody? Did you?
So I was temporarily, like for a short time, seeing a chiropractor in Jakarta,
Okay.
an American guy, and then chiropractic care in Indonesia became kind of illegal.
Okay.
And,
Not kind of.
Yeah, it's illegal.
It's
yeah.
illegal now, so.
And so since they've implemented that law, I've kind of done nothing. I've just been using like a lacrosse ball, rolling out my QL and stuff like that to kind of hopefully relieve some of the muscle
So you feel
tension.
it a little higher than your tailbone?
Yes. Yeah.
Okay, it makes a little more sense
Kind of
now.
get more in that like quadratus lumborum, that right side.
On
of
the right side, not the left side.
Left side, I don't feel anything.
Okay.
And then, sorry.
No, it's okay, go on.
And then, so like over the last, I've still trained that whole time, but in the last couple of months, I've started feeling aches and pains in other spots on the right side of my neck.
Mhm.
Started to be giving me a little bit of pain. And I feel like suddenly, or not suddenly, but like recently, my hips are shifted to my right side.
Correct.
I'm not standing straight as I used to.
Correct. Okay. So we have some stuff
Sounds like it.
going on. Okay.
Yeah.
So the question then, before 2 years ago, did you have any issues? Did you have any major slips, falls,
Yeah,
traumas,
a lot.
accidents?
So I was a skateboarder
Okay.
and just a crazy kid jumping off waterfalls
Okay.
and stuff
Where are
like
you
that.
from though?
Australia.
What part?
Queensland, near Brisbane.
All right. I
Yeah.
lived in Melbourne years ago.
Oh, nice.
Years ago.
Cool.
So I do see mechanically what's going on
Okay.
on these x-rays that you brought me. So you
Yep.
did bring me these full spine x-rays.
Yeah.
I do see some shifting going around, but there's one thing very important I need to show you as to why I believe this happened.
Okay.
And we're going to need to talk about this. We're going to need to figure it out, whether wherever you are, you're going to need a little bit of work done.
Sure.
Okay, wherever that is, whether
Yep.
you even go, we got some great guys in Australia.
Mhm.
We got great guys in Malaysia too.
Yep.
And I think Malaysia's a little bit closer.
Definitely closer.
Okay, we have some really good guys out there.
Okay.
2-3 in particular that I'll give you their information, because you're going to need to continue the care.
Sure.
Okay, but we'll figure it out today.
Right. Okay.
Fair enough?
Awesome.
Okay. What else? So that's the focus.
Yeah, that's the focus for sure.
Low back.
Lower back, maybe the neck.
Okay.
And
I'm
try-
going to do full spine.
Okay. Yeah.
How about extremities? Knees, elbows,
Knees.
wrists?
My right knee's a little bit funky, and I feel if I stand, I feel that I shift my weight on the outside of my right foot. It's all on the right side.
Correct.
But yeah, I feel I don't stand centered, and I also feel that my weight is kind of forward on my toes more so than on my heel or midfoot.
Interesting, because your x-ray tells a different story.
Okay.
And I think a lot of what you're feeling is compensation to what the real issue is.
Right. Okay.
So that's what I want to show you right now.
Cool.
Okay?
Yeah.
Let's go over to the x-ray. So first thing I'm drawing is the femur headline. Next thing I'm drawing is we need to measure the iliums. We can see the right side is a little bit on the short side. It's a short leg on the right. Okay? And we need to measure this. The other thing is we're going to have to factor in the fact that it is smaller, because the millimeter measurements is based on what we're using in the full spine, the big full spine.
Okay.
And that's okay. That's fine. It's not a problem. You with me here?
Yeah.
Cool. And as I go through this, if there's any questions, you just stop me along the way.
Sure.
There's also a lot of digestion stuff going on with you, which is also contributing to this QL. Okay? This right side, this is ascending, transverse descending. You have a digestion issue.
Okay.
And this is the area that controls digestion. That's also where your kink is.
Mm-hmm.
Okay?
Interesting.
So we need to talk about that, and I gotta talk about an easy fix for you. I'm gonna keep it simple.
Cool.
Okay, so this is 3 millimeters. Measured difference 3 millimeters. However, what is the ratio between that
Oh my goodness.
and this? Is it at least a factor of 2 or 3?
3?
Let's be conservative.
Okay.
3?
Yeah.
Not 4. I won't say 4. I'm talking about it. If we magnify this 2 times, it's still smaller.
Smaller, yeah.
If we
definitely.
magnify this 3 times, just for, I'm keeping it simple.
Yep.
So if it's a measure difference of 3, let's times it by 3. It's really a measure difference of probably 9.
Yeah.
And we'll measure it on you as
Okay.
well. So let's do a factor of 3 times 3, okay?
Yep.
So we have a measure difference of around 8 to 9 millimeters
Yep.
on that right side. So
So that means I'm.
you're off.
compensating. Yeah.
You're
by
off.
9.
Okay. So the right side is a little bit smaller. The question is it correctable or is a heel lift indicated? That's what we need to know. Your sacrum is off, by the way.
Okay.
You had some sort of trauma at the sacrum.
So I jumped off a waterfall before I was.
Of course you did.
Before checking how deep it was.
Okay.
And that didn't end well for my tailbone.
30 and 30.
So maybe that
30
could
and
be it.
30, maybe. Okay, so that's fine. There's no sacral rotation. 11, 1, 15. Aha. 1, 18. Okay, so we have an ilium. Now we're going to measure actually this side, AS3. AS3. So bringing this side down is going to bring that side up.
Okay.
The good news is with the factor ratio, you're not going to need a heel lift. However, we need to sort your left pelvis out in order to get that right side up.
Okay.
Okay, so that's what I'm seeing on that film
Sure.
so far. Okay, we do see digestion issues in through here and through here. You had something in the tailbone as well.
Mm-hmm.
Okay, it's healed up over here. Now the question is, this is from all the weights. Okay.
Okay.
Or skating or
Yeah.
whatever, life.
Sure.
When we're looking at both these x-rays, I want us to be more concerned with this one. And now let's go over this one, okay? So before I go over that, there are healthy straight spines. There are unhealthy straight spines. There are healthy crooked spines. There are unhealthy crooked spines on this x-ray. But on this x-ray, there's never a healthy straight spine here. You actually have a sway back.
Okay.
That's the issue. So your squats, the question is, did this happen from the workout?
Okay.
Okay? Or did this happen from, was it already there?
Mm-hmm.
Now, here's what I want you to see. It's a little off on there, but it's okay. Let's focus here.
Sure.
We're supposed to have 60-degree reciprocating curves.
Oh, wow.
Number 1.
Yeah.
Number 2 is, let's run the laser level on 5. That's the plumb line, and you're a trainer, so you should know this.
Yep.
The plumb line, when you do a lateral plumb line, hip goes through the shoulder, goes through the
Sure.
ear. C2 represents the ear. So now if we run the laser level here, so if you look over here, we're level, right?
Mm-hmm.
We're level here,
Yeah.
okay? Where are you at, dude?
Yeah. Miles off.
And it's coming from where? So 4 right at 3 from 3. So 2 is one of the issues. So at 2 the whole body goes back. Okay? Do you see that now?
Yeah.
Now the question is it really 2 or is 2 compensating from a pelvis?
Okay.
That's what we're going to find on you. This is just an x-ray telling us what it is.
Sure.
Okay?
Got it.
Does that make sense?
Yes, it does.
Okay. There's a lot of good news though.
Okay.
Okay? You have good discs, even though it looks misleading. I see an atlas issue here. I see a lot of AS. You carry your head up quite a bit.
Mm-hmm.
Okay, is that his normal? Is that how he normally presents? He's always like this with his head up a little bit?
Maybe don't realize.
That's okay.
I feel that I kind of tilt my neck a little bit to my right side as well.
Yes, you do. And you're tilting, you see, look, from here we got a little bit of a curvature, right?
Yeah.
Heart is a good size. I like that. This is called the Blvd. That should be a little bit bigger for you. That's digestion. Goes back to digestion.
Yep.
Okay. Now, you start to do this. So it starts to shift to the right, comes back to the left. Then right at the upper T-spine, right around T3, you have a side shift. You had another trauma here. So we had something in the low back.
Yeah.
We had something in the pelvis. We had multiple issues going on here.
Yeah.
So it is what it is. You'll need a little bit of care.
Sure. Yeah. Okay.
And we'll figure out. Come over here and let's start at the base of the neck. As I run the meter, you can see I want you to focus on the needle there. So we got a big rake right around that T3 I was talking about.
Yep.
Okay. Good. T3. So we're looking for it to break back. You can see your right side is a lot more developed than your left side, correct?
Definitely.
And there it is. Down in the sacrum, T3, and let's check the neck. So the good thing is all your activity has maintained you.
Okay, great.
And no one's telling you to stop what you're doing, by the way.
Okay.
Okay?
Someone by a doctor I saw tried to tell me to stop. I took a large break to kind of let it.
Yeah, I mean you need to heal,
Sure.
but you don't need to stop. You have great discs.
Okay, that's good.
You gotta get your curves back, okay?
Yeah.
So I'm getting 1, 2, 3 readings here, okay?
Yeah.
Let's go ahead and run my fingers along the spine. And you can see right there, it starts to change, right there. Tender here or here?
Yeah, definitely that.
Okay, that's 7. 1, 2, 3. Let's go ahead and motion. 1, 2. Yeah, 3, 4. Let's keep running the fingers. Kind of matches. The right side is lower, the left side is higher, his dimples. Now, we want to see which side is fixated. General motion. Go ahead, feet together, open and close your knees. Left side only. Right side only. Here's what's interesting. Doing this, they both move actually pretty decent. Decent.
Okay.
Let's do that again. Let's go a little. Let's focus. I'm going to dig in just a little bit more.
Okay.
Go ahead and do both. Right side only. There it is. So when I do the right, the left wants to go with it. It's subtle though. Do the left side, but the right's not moving, meaning it's fine. So when he does the right side, because the left side is slightly stuck to the sacrum, it shifts a little bit. Okay? You feel what I'm talking about?
Definitely.
Open and close the right. Yeah. You can see the line switch too. Do the left. See the difference? More tender here at S1 or S2?
S2?
Yeah. That's S1.
Definitely S2.
That's L5, not L5.
No.
S1. This is S2 right there.
Yeah.
So left pelvis, S2, T3, walk it off. Now, you pronate that right foot because of the short leg, and that's why you do this. And what he does, he pronates that right foot. Sorry, supinate, not pronate. You supinate that foot. And you do that because supination raises that leg up. Okay. Versus pronation drops it, okay? So, cool. Nice and easy there. T3. Nice and easy there. Good. Nope. It's not happening there. Let's go on the orange table. I was hoping to get something to move a little bit to make this a little easier, but it's okay. 7. 1, 2. There it is. You feel that, yeah?
Yeah.
Okay, T3, side slip. Dude, that thing is a board, yo. You gotta make me work for this one.
Oh, yeah.
Let's come on this side. Holy smokes. Wow. Come up. Let's see if something shifted anyway. Something had to have shifted. I was bouncing off your spine, you notice that?
Yeah.
So when I'm bouncing, that means there's the upper cervical.
On the with the orange
Yeah.
label. I felt a little bit of a...
Tiny move. That actually cleared it though.
Oh, really?
Yeah, I'm tripping right now. But we're gonna have to go to your upper cervical.
Okay.
That's so weird. Okay. There we go. Breathe through it. Good. Breathe in.
Oh, my...
There. Gotcha. That was what I wanted. Good. Hands forward. That should feel very different.
Oh, yeah.
Again, because you have a lot of scar tissue in your
Mhm.
body,
That's
or
right.
adhesions.
Yeah.
So I'm just kind of breaking through some of that
Okay.
stuff, for lack of a better term, okay? You are walking different. There's less supination already.
Mm-hmm.
I don't know if you feel that yet. There's less of this.
I just feel like a bit of... I don't really feel it in the feet too much, but I definitely feel it like some tension off the neck.
Off?
Yeah.
Left ear down. There's the
Oh,
rest.
Wow.
That was a home run. Get up. There you go.
Wow.
Because we got the release off here, all of it is starting to release now. Nice. Ah.
Oh,
There you go. Nice. Come up slowly and walk it up. There it is. Wow. The other thing I want you to see in film, when he starts to walk away, when we look at the first part, his right side muscle in his back was more fired. Look at it now. They're starting to get more symmetrical already. You should be feeling that move a little bit easier.
yeah.
Okay? When he turns around, I want you to turn around, I want you to fire, I want you to focus here. This was a lot more than this side. It still is, but this is starting to activate. Go ahead and walk. Very nice. Chin up. And tummy needs to go all the way down, sir. Yeah. There you go. Good. Muy bueno. You okay with that?
Yeah, man.
Good stuff. Tummy down. There.
Oh.
Gotcha. Home run.
Oh, my God.
Very nice. Come up slowly, please. There you go. As you're walking, tell me what's different. It's not about what's good or bad. Just
Sure.
tell me what's different.
I feel when I used to walk, I could always feel just like a bit of a pinching issue there.
Mm-hmm.
It's not that it's gone, but it's definitely, I'm feeling it a lot less, which is good.
Okay.
I just feel lighter as well.
You're walking lighter, yeah.
Yeah, walking much lighter.
Have a seat. Let's run the meter. So 3 is clear.
Awesome.
But let's make sure this didn't clear. There's no battery or switch on this scope, by the way, okay?
Mm-hmm.
So we can't. This is muscle right now. Let's check down here. Clear. Open and close the knees. Right side only. Ha-ha. You see how the left's not moving with it?
Yeah, I can even feel that.
Left side only. Butter. Nice. There you go. Beautiful. Over, around. There you go. Over, around. That's it. Yes. Stand up. Squeeze. Good. Squeeze. A little bit on the radial head. And the wrist. Whoa. little bit on the lunate, scaphoid. Squeeze. There you go. Squeeze. Last thing on your back, I want to do your ankles. Okay. Talus. There you go. Now talus.
So, I mean, when you said that I was supinating, when my ankle was supinating.
Yes.
So right now I feel like, I don't know. I felt like before I was kind of like swinging a little bit, whereas now I'm kind of like lifting with.
Correct. There was a little waddle in your step.
Right. Whereas now I feel like, knees being raised rather than swinging out to the side.
Okay. What else?
Just feel light.
Okay.
Feel good.
That sounds good to me.
And if I bend down, this was my biggest issue, is like kind of going into.
Sit on the floor, please. Just sit for like 5, 4, 3, 2, 1. Stand up. Should be easier.
Yeah, definitely. That was actually something I was going to ask. Is with sitting, I tend, like I sit a lot. I find that I kind of slouch a lot.
On a chair or a stool?
Yeah, on a chair.
Okay.
So what would be like the ideal way for me to be sitting?
I use these. This is gold for the back. Blow a little bit of air in there. Not a lot. Like 2 breaths. Let me see. Yep, that's it.
Okay.
You have a back support, I'm assuming, on the chair?
Yep.
Sit back on that chair when you see how it feels. Can't really work like that though, can you?
Huh. Wow.
Okay?
Definitely feel it.
It's genius.
Yep.
Plane rides, I take them myself,
Yep.
even on whether it's economy, business class, it doesn't matter. That creates the curve,
Yep.
right? We need curve.
Sure.
Okay, the other thing is we don't want the back to be stagnant.
Yep.
If it's fixed, if it's stagnant, what happens? It's gonna come right back.
Mm-hmm.
Wiggle around a little bit. You're always able to move.
Right.
You can even do minor pelvic thrusts,
Sure.
anterior pelvic.
Yeah.
Right?
Yep.
You feel that?
Yeah, definitely.
That's what I use. I keep
Okay.
it really simple.
Yeah, right.
And the other thing is I have a video of flossing for your spine.
Okay.
So it's a lot of back extension exercises. You got to get the curve in the low back.
Yep.
But by doing that, we also need to bring the upper torso forward.
Mm-hmm.
Upper torso is not going to come forward unless you get that curve in your low back.
Okay.
The good news, there's not a lot in that foundation. We got a lot of it today.
Sure.
You didn't get this big, huge audible like you were, I'm assuming you were expecting.
Sure, yeah.
But it moved.
Yeah.
Okay, it did move. Walking now, lots of them when we're done here, you walk 20, 30 minutes or more.
Yep.
You gotta ice. Last thing I need to do your nose. Go on your
Oh.
back. I just noticed it.
Facing forward?
Yeah, on your back.
Oh, my back.
All right, it's the $5,000 nose job. That's what they charge for the deviated septums. Your septum's deviated a little bit.
Oh, yeah?
Yeah. Look.
Another accident.
Look.
Yeah, there's a weird bend to it.
You see it or
You
no?
never saw that?
Yeah.
But here's what's misleading. It's high on this side, not on this side. So it bends like this. So I gotta actually be on that side. Excuse me. That's it. One more. You're all right?
Yeah, that's fine.
Okay. That's it. Got it. Got it. Breathe in. There you go. He's gonna tell you when he gets up, okay? That should feel different.
Yeah, man.
Okay? That's it.
Awesome.
Welcome.
Thank you.
Pleasure.